Assalamu alaikum everyone and welcome to my presentation. First of all, I would like to thank you for your trust in our Advanced Education Academy. Let me start by saying a few words about me and my own background. My name is Ahmed Nadi. I have completed my nursing bachelor from Cairo University in 2012. And I have completed 3 semesters of psychiatry degree from Ain Shams University. And to make it short, let us get into the point. So welcome again. As you can see on the screen, our topic today is nurse burnout, and no one can deny he's suffering from such a phenomenon in work field. That's why I picked this one, considering its great impact on our service and patient quality of care. But before we start, I need only to focus on learning objective in 2 main issues. First of all, general learning objective. Generally, at the end of this lecture, all of us would be able to identify and deal with a stress. Secondly, is a specific learning objective. By the end of this lecture, attender would be able to identify burnout, recognize causative factor, and identify the danger or prognosis of burnout. And finally, enumerate overcoming and preventive methodology of burnout. Here are the outlines we are going to discuss today, starting with introduction, causes of burnout, danger or complication of burnout, and finally, how to prevent burnout. Nurse burnout is a widespread phenomenon characterized by a reduction in nurses' energy that manifested in emotional exhaustion, lack of motivation, and feeling of frustration. That may lead to reduction in work efficacy. In brief, we can define nurse burnout as a mental, physical, and emotional exhaustion due to work area. As per National Nursing Engagement Report in 2019, about 15.6% of nurses report emotional exhaustion. Furthermore, causative factors directly contribute in phenomena is prolonged work hours. Obviously, burnout is 2.5 times more common in nurses who work shifts of 10 to 13 hours as opposite to 8 to 9 hours. Another cause is the lack of sleep. This is common for nurses who work long hours and consecutive shifts. In surveys that conducted by Crohn's Incorporation, 25% of nurses reported that they were unable to get enough sleep between shifts. One of the most effective factors is the irritating and stressful work area. Obviously, we all can easily compare between elective area like OPD and the critical area like ICU or ER, in where there are a lot of negative and stressful events aggravating the burnout. Feeling lonely and poor teamwork, which is characterized by conflict, lack of cooperation, and even peer bullying, all makes for unpleasant work environment and can lead to medical error and burnout ultimately. One more cause, since a human being full of emotion and feeling, it's so hard to tolerate patient suffering or disease that lead to burnout and feeling grief. The more responsibility, the more nurse burnout. Simply, when you get overloaded in the work, it makes you exhausted and feeling bad. The next section will discuss the complication of having burnout. Turnover is one of the main concerns supposed to be monitored. It was reported that the majority of the turnover it was relevant to burnout. Not only staff involved in this, the burnout and the staff exhaustion will negatively impact the patient's quality of care and causing recurrent incident report. Another bad side of poor quality of care is the increased mortality rate. In the studies that were conducted in Marshall University, nurse-to-patient ratio greater than 1:4 were not only correlated with the higher percentage of burnout, but for each patient added to the ratio, there was a 7% increase in the mortality rate in the hospital. Last but not least, the management of burnout. At the beginning, the manager has to consider after-work life for the employee, besides avoiding working overtime. One more burnout management tip is to have break. When you feel relaxed and give an opportunity to your body to regain his own power. If you feel hopeless and depressed, be sure that you are seeking for a help from your team, especially your team. since it can give you outlet to vent frustration and discuss conflict. And also you can check for challenge so that you can perform your duty well, with no hard feeling and very relaxed. Finally, I would like to thank you for your listening and your time, and I would like to finish with a famous quote. Remember to take care of yourself. You cannot pour from your empty cup.